I'm Dr. Stephen Loyd. 16 years ago, I thought my life was over. I got addicted to pain medications, OxyContin, oxycodone, as well as benzodiazepines, Valium, Xanax, and I'd always struggled with alcohol. I crashed and burned. I thought that everything I'd worked for my entire life was gone. I'd been to medical school, through residency, was out into private practice, living my childhood dream of being a doctor. And then all of a sudden, it came crashing down. This is my story of what it's like, what it was like, what happened, and what it's like now. And to help me tell that story, I'm going to bring in my son, Heath, who at the time I went to treatment was 9. When I first started using prescription pain medication, he had just had his 5th birthday. So, Heath.
What's going on, Dad? Great to be here, buddy. I guess I'm going to get this started, guys, by just kind of asking a few questions around it and just kind of let him tell his story. And I may throw my point of view in there a little bit, but not too much. So, Pops, first just tell us, I guess me, since I was only 9, I don't really remember too much about it. So why don't you just give me a little bit of background?
Well, I was in my last year of residency and had trouble in the past with alcohol. I knew I never could drink successfully, and I didn't drink all the way through medical school. And so when I got into residency, I really didn't drink through residency. And I'd have a beer every now and then, but nothing like it used to be. But on my way home from work one day in my chief resident year, I was about 6 months away from going into private practice, or actually taking a job at the university where I went to med school. And it felt like I had all this pressure on me. You and your sister were young and you were getting ready to start school, and she was even younger than you. And now my name's going to be on the bottom line. So I felt like I had all this pressure. And so I was driving home from work, and I was anxious, I was depressed. At the time I wasn't getting along with your mom very well. And I stopped at a red light in Johnson City where I was doing my residency, and I opened the glove compartment of my truck, and there laid some Norcos, hydrocodone, that I'd gotten from a dental visit months before. And I looked at those things. I'd never taken pain pills before. The ones I got from the dental visit, I just threw in the glove compartment of the truck. And I looked at those and I said, my patients take these things all the time. And so I reached over, I pulled one out. It was a little blue pill. I ripped open the package, broke it in half, and threw it in my mouth. It was 2.5 milligrams of hydrocodone. At the time, we were living about 10 minutes away. Mm-hmm. And by the time I got home, I felt like all that anxiety and that depression had melted away. Suddenly my life was a little easier. Yeah. The problems I had didn't seem as bad. And me and your mom seemed to get along better. Mm-hmm. So really it just eased the psychological pain and the emotional pain that I had going on from the realities of my life. And what I didn't realize at the time, Heath, was my previous problem with alcohol, along with my childhood past of trauma, put me at risk to misuse that prescribed controlled medication that I had in the glove compartment of my truck. I never knew that because we never learned about that in medical school or residency, which you would think that you would learn something about that, but we didn't.
Yeah, it's weird to think about that. You had all this pressure on you, and you were somebody that from the outside, when they're looking at doctors, like, oh, doctors have it made. You've got this great life, you've got all the, you got all this money, all these things. And in reality, what it really is it was a lot of pressure building up on you. And I guess it led to that. Honestly, you kept it from me. I had no idea about it whenever I was growing up. But even throughout that, that was the start of it. So what happens after you take that first little, when you start to feel better? So, obviously we know you have a problem, time has passed. So how did you get to where you were taking as many as you were at one time?
Well, the thing is you're right. People looked at it from the outside, and, I was living my childhood dream. The house we were living in, 3 years after I took that first pill was, the house me and your mom wanted from the time we first started dating. Matter of fact, the neighborhood that you grew up in, when I was a little boy, my parents used to drive me through that neighborhood at Christmas time to look at the Christmas tree lights where the rich people live. And we lived in that neighborhood. And, had cars, had everything I ever wanted, but I had this thing inside of me that just wasn't fulfilled for whatever reason. And no matter what I did, I could never fill it up. So, I wanted to be in a profession that people looked up to, and I wanted to prove that I could be something besides, what my family had traditionally been. And nothing wrong with that, but I didn't want to work on cars, and I didn't want to do, the other things that my family had done. And so I wanted to go to college. I was the first one in my family to graduate college, and then go on to medical school. So yeah, from the outside, it looked great. It looked like I was a success. But when I took that pill that day, within 3 years, I was using 500 milligrams of oxycodone a day. I'd set up all these little barriers, right? So I'm not gonna use when I'm at work. I'm not gonna use it, before 5 o'clock. I'm not gonna use when I'm around my family. The truth is, I busted through all those. And at the time, you were coming into baseball playing age, and you played baseball right up through college, and I was coaching your teams, and all the kids that you played with, and many of those days that we were practicing and that we were playing in games, I was using pills during that time, and you kids didn't know.
Yeah.
And there's one specific story that really shakes me when I talk about it, and I'm not even sure if you know this one, but we were in the state finals in Little League, and I'm the coach, and I'm out, before the game, hitting you guys ground balls and fly balls, and I had my pills in my pocket, and they fell out, and the top of the thing I carried them and just spilled out on the ground. So all the pills were out on the ground, and we're getting ready to play for the state championship, and you guys are all fired up. You're 8 and 9 years old or 10 years old, and it was the time of our lives. And I realized when I got in dugout right before I was getting ready to give the starting lineup that I had spilled the pills, and I couldn't find them. And so I had my assistant coach, Robert. I had Robert, give you guys a lineup in the pregame talk, which I always did, but Robert did it that game. And I was out in the outfield going through the grass looking for pills. And that's how desperate that it got, because I didn't start out that day to get myself addicted to pain medication. That wasn't the goal. It just made my life a little easier. It made work tolerable. It made the stresses go away. But before long, I had to have it even just to get out of bed. The first time I was dope sick, I had no idea what it was. Yeah. Now keep in mind, I've been to medical school and residency. I'm board certified in internal medicine. And I had no clue what it was. I'd been a couple of days without Lortabs, which is what I was using mainly then. And I started to get really sick, and I felt like I was coming down with the flu. And I came home and told your mom, I think I'm getting the flu. And I went upstairs, got in bed, I was sweating, I felt feverish, I was shaking underneath the covers, and then I was burning up. And then the next day when I got my hands on the pills and I was better in 2 seconds, I was like, oh, I know what this is. And from that moment on, I had to have them to get out of bed. I had to have them to go to sleep. I had to have them all day long, every day.
Yeah, and I think that's something that some people that have never struggled with this don't really realize, but it makes you feel so normal that you have to have it. You've tricked yourself to where you have to have it. And then on top of you tricking yourself that you have to have it, you have physiological reactions where you have the worst flu of your life. I mean, you really don't have a fighting chance. And you being a doctor who should know about this, didn't know about it. So how can anybody else know anything about that?
The thing that you said there, should know, that's interesting, because all through medical school and residency, do you know how much training we got on the proper prescribing controlled substances for acute and chronic pain, and what the side effects of those medications were, and what addiction and dependence were, and more importantly, how to recognize it and refer people to treatment? You know how much training we got on that?
No.
None. 0 hours. And so when I tell people that when I'm doing talks now, they can't believe it, but that's absolutely true. We got no hours on any of that. And so when we started writing pain medication, we graduate medical school, we graduate residency, we pay $730 to the DEA for this number that allows us to write controlled substances, mainly pain medication and benzodiazepines. And then, I have no training in any of that. And so how in the world do I know what to write? Well, I learned it from the people who taught me. Well, where did they learn it? So, I don't know where we get back to zero, but we had no training on any of that. So I never realized any of the things that were happening to me. I didn't know the difference between dependence and addiction. I didn't realize that there would get to be a point where I couldn't do without it. And the truth is, Heath, I would do anything to get my hands on it. I stole it out of people's medicine cabinets. I stole drugs from I stole prescription medications from a dying cancer patient while he's in the next room, because I couldn't do without it. And then the shame and the guilt that followed that just led to more drug use, because I felt so bad.
Yeah.
And it was really just a spiral that I didn't think I'd ever get out of. I'd almost lost hope.
Yeah, and I think it's very important. I love how open you are about this, and some people ask me questions like, do you ever worry about stuff like that? I'm like, no, not really. I think it's great how candid you are, because a lot of the stigma around it is that the people who have this problem are of the lower intellect, right? They're not as smart as the rest of the population. And me, knowing you personally, know you are my dad, you're incredibly intelligent, and yet you were crippled by not being able to have this pill. I mean, it's just a tough battle. It's a tough battle. Prescription
pain medication and now, opioid use disorder, it's mainly heroin and illicit fentanyl. It doesn't know any socioeconomic class. And, I'd have people say, well, they would tell me in addiction, well, when it gets so bad, you'll notice, because their job performance will start slipping. And my job performance was great. Yeah. I was the top producing doctor in our practice for the 3 years that I used, every single year. And one of the 3 years, the graduating medical students voted me the best teacher in the whole medical school at their graduation. And the other 2 years, I was voted the best instructor in internal medicine during their third year clerkships. And so, the problem is my home life was falling apart. And you guys remember that. I would come in, I would isolate. I was good when we were coaching ball or I was doing things with you, but outside of that, I was detached. And so my home life was falling apart, but work life was still good. And I wasn't a horse's rear end in the hospital, so I wasn't throwing things, I wasn't getting mad, I wasn't getting upset at people. And so nobody really had a reason to complain on me. And my work life was actually, held together. But at home and every other area of my life, Heath, I was dying. Yeah. And towards the end, I went to bed half the nights praying that I wouldn't die and the other half praying that I would.
It's a tough way to live.
It is. It's a horrible way to live.
We've talked a little bit about some of the things that have gone on. I know since I've heard many a time you've done this talk and you've talked about your story, so I know there's a few events that happened. And the last one that we left off with there was you talking about searching the Little League outfield looking for pills like that. But everybody talks about this rock bottom, which I've heard you say multiple times, thank God rock bottom wasn't death for me, right? Some people it's death. And you have a rock bottom moment, and I've heard it a few times, and I think we're on the same page here. Why don't you share a little bit about what that is?
Yeah, the rock bottom moment for me, though, there was still a period of time after that where I still used, but when this happened, I knew that something needed to happen or I was going to die. Mm-hmm. And so I was rounding in the hospital with the residents one morning. We always started out in the ICU. The sickest people are in the intensive care unit. And so I'm teaching medical students, medical residents, pharmacy students, pharmacy residents, and I've got them all around me. And so the very first patient we come up to was a female, and she was on the ventilator. She had overdosed the night before, and she had overdosed on Tylenol. And so my resident who was giving the report on the first patient, his name was Scott Brown. And Scott was outstanding, and Scott's going through her history and what happened, what brought her in, what we had done, what the plan was. And about midway through it, I stopped it and I said, "Hey, Scott, I was just curious, how many Tylenol did she take?" And the number he gave me was less than I was taking on a daily basis. Because you got to remember, oxycodone and hydrocodone, when they're combined with Tylenol to make Lortab and Percocet, there's 375 to 650 milligrams of Tylenol in every one of those. And I'd gotten up to 100 pain pills a day, 500 milligrams. Mm-hmm. And so Scott told me that number, and Heath, I couldn't get the pencil down to the piece of paper to write my note. This is before electronic medical record. Because she's laying in there in a coma. We're getting ready to life flight her to Vanderbilt to look at a liver transplant. And I'm standing there and I'm taking that every single day. And I stopped rounds right then and I looked at the team and I said, you guys go back to, going around on your own. I never did that. And I walked into the restroom at the end of the ICU at the Johnson City Medical Center, and I closed the door and I locked it, and I sit in there for about an hour and I cried. And I was looking at the mirror and going, I don't know what's going to happen. I can't tell anybody or I'll lose everything I've worked for, but I can't stop. And I was going to die either way. And at that moment, that was the lowest I felt. And I actually contemplated taking my own life at that point. But thankfully I didn't, and went on for a little while longer, but it wasn't long after that before I got help.
Good. I'm glad you didn't take your life, coming from your son. So I do want to actually talk about help a little bit, because that's kind of like my flashbulb memory of all this. Like I told you before, I don't really remember a whole lot of it, but I can remember that day when you were on the front porch and you were leaving and all that, and I didn't really know what was going on, but I can remember a little bit of that distinctly. So I guess my memory comes whenever you started to get help. So why don't you give me a little bit of insight, and as well as everybody else listening, a little bit of insight into how treatment was for you.
Yeah, this is kind of the what happened moment. So I'd taken you down to go hiking with Dad. My dad is a big hiker, and so he wanted to take you out that day. And so I met him down at a grocery store not far from the house. And at the time, I was carrying pills in the drink container in my truck, cup holder, and they were just bowled over in there. There's hundreds of them laying in there. And so I took you down there. Dad was right next to the window, and you got out and walked around in front of the truck. And Dad told me where y'all were going, and he'd bring you home the next day. You're going to stay all night with him. And so I still remember you guys walking off. And as soon as you walked off, I reached over and I grabbed 15 10 milligram Percocet, little school buses, yellow Percocets, threw them in my mouth, swallowed them, no water, nothing, just swallowed them straight out. And when I turned around, my dad was standing right there. He hadn't moved an inch. And he looked at me and he said, "Steve," he said, "did you just take a whole handful of pills?" And you know what I told him? No. I told him no. He just saw me take them. I said, "No." And he said, all right. He said, "Well, I'll see you tomorrow." And so I drove up the road, didn't think anything else about it, and went to work the next day. And when I came home, I was expecting you to be there, expecting him to bring you home. And when I rounded the corner and I looked up on the hill, I saw his truck. And I knew he was still there, and I knew he brought you home because it was late in the afternoon. He brought you home in the morning. And so I knew what he was there for. And so he said, "Hey, Steve," he said, "we need to go see your sister." Well, at the time, I hadn't talked to my sister in a long time, and I didn't want to go see her. And he finally talked me into it. And we're going down the interstate up to where she works, and about 15 miles away from the house. And Dad looks over at me and he said, "Steve," he said, "do you have a drug problem?" I said, "No, Dad." I said, "I don't." I said, "I'm tired. I'm working at multiple hospitals, and I'm just worn down." So he said, "Okay." And we drove probably another 2 or 3 miles up the road, and he put his hand over on my knee and he said, "Steve," he said, "you have a drug problem." I said, "Dad, I do." And I started crying. And even though I was, about as low as you can get at that moment and really just ugly crying, at the same time I felt relief because finally somebody knew. And I felt like a guy that was out in the middle of the ocean and was going to die, and then all of a sudden the ship shows up out of nowhere and slings a life preserver over to me, and I just grabbed onto it, and from that moment on my life started getting better. But as we drove up the road and I was crying, I said, "Dad, I'm gonna lose everything." I said, "I'm gonna lose my house, I'm gonna lose my cars, I'm gonna lose everything that I've worked my entire life for. I'm gonna lose my medical license." And he looked at me and he said, "Steve, none of that stuff's gonna do you any good if you're dead." And to this day, 16 years later, I do not have a retort to that question because he was right. I wasn't going to be around to watch you grow up. I wasn't going to be around to watch Haley get married. I wasn't going to be around, probably not much longer than another 6 or 7 months at the rate I was using. And that's when it all changed. Mm-hmm. And so coming home that night and, telling your mom and then telling you guys was the hardest part. And, you were 9. And Haley was, she just had her, 6th birthday, not just a couple of months before. And that was really, really difficult. And I didn't know if I was ever going to see you. I had no idea what treatment was. And they said, "Well, you're going to be gone 3 months. And I was like, "Well, not really. I'm good at taking tests. I'll be gone 3 weeks." And so I packed for 3 weeks. And of course I was gone for 3 months, but it absolutely changed my life and put me on the path that I've been on for, these past how many ever years. And it really changed everything about me.
So, being so young, I didn't really have a whole lot of information, right? Nobody really told me much, and I think that was a good thing at the time. I knew you were going away, had no idea where, and I knew that my grandfather was taking you for some reason, and I didn't quite understand what was going on. So just, why don't you give me a little insight into that?
Well, I wound up finding a place in Nashville called the Center for Professional Excellence that treated doctors. And I also learned about something called the Tennessee Medical Foundation, which provided advocacy for doctors who had substance use disorder and behavioral health issues. And so those were 2 things that were positive going in because I didn't know either one of them existed. Mm-hmm. So you're right. Your grandfather, my dad, took me and we were headed down the interstate, and I used the whole time. I was taking pain pills and Xanax and Valium all the way down there. And so we pulled into the parking lot of CPE, and the Nashville Zoo is right there, Grassmere. And I walked over there, and I knew I couldn't go into treatment with 2 pockets full of pills. I still had both my pockets. At the time, I was using OxyContin, which turned out to be my drug of choice. And so I threw a handful in my mouth, but I still had 2 pockets that were full. And I reached down in my pockets, I emptied them, and I just threw them over to the gorillas, which were just right down below me. I mean, there's only a chain link fence sitting in between the 2 of us, and I walked in. And they took one lick at me and knew the amount of medication I was using, said, "You're going to have to go to detox." I didn't have any idea what detox was. And my best friend Darren had met me in the parking lot, and so he rode over to detox with me at the Vanderbilt Psychiatric Hospital. And I'm sitting in there waiting to be admitted, and all this stuff is going on. And he puts his hand over on my knee, and he said, "Steve," he said, "you can do this." He said, "Don't look at anything around you. Just keep your mind focused on what you need to do." And so I was in the detox unit for 5.5 days at Vanderbilt. And this is, Heath, where I started to get gratitude, even though I hadn't even been to treatment. Because at the end of those 5.5 days, there were 24 people on my ward, all of us with prescription pain pill problems and heroin problems and everything else in the world. I wasn't separated because I was a doctor. And I started to get gratitude because I was the only one of those 24 that got to go to an inpatient treatment facility after those 5 days. The rest of them were all young. I was in my early 30s, so I was young compared to what I am now. But they were teenagers and in their 20s, and they all had to go right back to the street after 5 days. And I have never gotten rid of that feeling that I had when I realized that. because I realized because of what I did as a profession, because I was a doctor, I was going to get much better treatment and care than they did. And so I left there and I went to hung out with Chip Dodd, who saved my life for the next 90 days. I learned about addiction. I learned about the difference between addiction and dependence. I learned how my childhood past of trauma, both physical and sexual, as well as my family history of substance use disorder, primed me to pick up that first pill, and how when I picked it up, that addiction was almost certain. And I learned things about myself that I didn't know. I didn't realize my own codependency. I didn't realize that my value was wrapped up in all these things outside of me. The fact that I had a medical degree, or I was a doctor. And as I realized these things and started to learn a new way to live, my life changed. And I thought, surely it can't be this easy. If I do these things, if I have these 8 feelings and then I acknowledge those feelings and I learn how to live with those feelings, and I learn that I can be okay no matter what. And if I learn to look at my role in things, no matter if I'm 1% at fault, the other person's 99% at fault, I can't change that 99%, but I certainly can change the 1%. And as I learned how to do that more and more, my life changed. And the ironic thing is that whenever I became willing to lose it all, I got to keep it all.
Yeah.
And my life has done nothing but go up since that time.
Well, why don't you expand on that? I mean, you got out of treatment. I mean, so you come back in, and a lot of the things in recovery talk about your environment. You're actually going back into the environment in which, you actually started all of this. And so that's got to be a little bit challenging. So you come back from Nashville and you're headed back to the Tri-Cities. So what was work like after that?
So I go right back into being a doctor.
Yeah.
I was off for a week after I got out of treatment, and then right back to seeing patients. And so I was around all the pills and all the things that, that had gotten me off track, those months before. But to be honest, Heath, it was never a problem. I put safeguards in place. I had people not bring their medication in. And then when the electronic medical record got there, it didn't matter anyway. If they mistakenly brought it in, I stopped the appointment whenever it was. I went and got a nurse. They cataloged it. And then from then on, patients just wrote down what they were on and brought it to me. So I put safeguards in. I had a wonderful supporting cast around me, the people I worked with, your mom, all the guys I coached ball with back in the day. Just put this, this safety net around me and supported me in my recovery. And so when we would go off and play baseball, I always made meetings, and, I'd get up early and go to a 12-step meeting before we went to play. And the guys that I hung around and that we traveled with would take you guys to breakfast, and I'd meet up with you later. And they were just really great. I had this wonderful support system. And then my life just started slowly getting better and better and better. I went from a guy who, was using drugs, using prescription pain medication while seeing patients. And now I'm to the point where they asked me to be the program director for the internal medicine residency. And so I'm in a leadership position. I'm over the training programs for all the young internal medicine residents who are coming out of medical school into residency. And not long after that, I became the Associate Chief of Staff for Education at our VA. So now instead of over one residency program, I'm over 35 residency programs of everything from surgery to OBGYN to audiology to physical therapy. And I'm doing that. And the whole time I'm keeping true to these principles that I learned early in my recovery, right? I was no longer involved in administrative wars, because anytime I had a conflict, all I had to do was apply the principles I learned in recovery. And I maybe can't change that other person's point of view, but what I can change is my reaction to it. And as I did that more and more, I kept getting higher and higher leadership positions. I wound up being the chief of medicine, and for a while, I was the chief of staff at our VA at Mountain Home in Johnson City. And not long after that, I started really getting interested in people who struggled with the things that I did, because I realized the playing field wasn't the same. That people didn't get the same treatment that I got. And I became really interested in medication-assisted treatment as a way to level the playing field. And so I started dabbling that on the side and learning all I could about addiction, because I already told you what kind of training I got in medical school.
Right.
And really that became my passion. So I started working for the federal government as an expert witness in drug cases against doctors for misprescribing. And then I was involved in the treatment side of things, of utilizing medication to hold people in treatment until we could achieve the behavioral change and address childhood trauma that put them on a path to recovery. And I traveled to Nashville to testify before our state legislature, and I'd never done that before, about the need to reach out and help people with opioid use disorder, because it was killing so many Tennesseans each year. And after I testified, I got offered a job in the Tennessee Department of Mental Health and Substance Abuse Services. And from there, I actually became the state's opioid czar. That was my unofficial title, but I was the assistant commissioner for substance abuse services for the entire state of Tennessee. So I was over all the treatment programs in the state because we were the head of licensure. I was over all of the outpatient treatments that used medication. I was over drug recovery courts that helped people who had criminal charges, but who also had substance use issues. Instead of incarcerating them, getting them help and putting them back on the path to a different life. And so I got to do that for about 2.5 years under Governor Bill Haslam. And then whenever Governor Haslam left office, I moved into my current roles where I'm the medical director for multiple treatment facilities, both inpatient and outpatient. I'm a national speaker on opioid use disorder, proper prescribing and controlled substances, and I'm an expert witness for the Federal Bureau of Investigation, the DEA, the Tennessee Bureau of Investigation, and multiple other state and federal agencies that prosecute doctors for misprescribing. This past July, our current governor, Bill Lee, appointed me to the Tennessee Board of Medical Examiners. And so I'm not saying that that's going to be the route for everybody, but that's been the route for me to this point. And the things that we currently face in our pandemic, I apply those principles to recovery in that. I can't change what's going on outside of me, but what can I change? I can change my reaction to it, and I can always remember to get outside of myself and help others. And as long as I keep continuing to do that, no matter what goes on out here, I'm going to be okay. And if I'm okay, then I'm able to help others become okay. And that's the most important thing to me in my life now.